I'm giving an oral statement on behalf of the World Stroke Organization and the European Stroke Organization. While the world is preparing for the 2018 High United Nations meeting on non-communicable diseases, the proportion of NCDs continues to increase in Europe. Stroke is a tragic example of this insufficient progress. Over the last 25 years, stroke has become the second cause of disability and the second cause of death worldwide. Given this large-scale problem across all countries and continents, stroke is about to affect everyone directly or indirectly. This is an avoidable tragedy for patients, families and societies because stroke is largely preventable and treatable. Europe's progress in prevention and treatment of NCDs is modest. It is worth remembering that 90% of stroke are linked to 10 modifiable risk factors. Those include hypertension, smoking, overweight, physical inactivity, and unhealthy diet. These factors are essentially the same as for ischemic heart disease, the other main cause of disability and death in Europe and worldwide. As a neurological disorder, most survivors of stroke carry a lifelong burden of physical, cognitive, mental and socio-economic consequences. The World Stroke Organization and the European Stroke Organization call upon the European Regional Committee of the WHO to support its member states to increase their efforts in 3 domains targeted by the World Stroke Day in 2017, which says, face the facts, stroke is treatable. Number 1, awareness. We invite WHO to strengthen programs that increase awareness of stroke symptoms, stroke risk factors, and the consequences of stroke. Number 2, access. We support the WHO in its efforts to remove financial barriers to prevention and detection of NCDs, including through universal health coverage. This will allow for implementation of population-wide prevention strategies. And number 3, action. We offer to support the WHO in the development of regional and national strategies to deliver the health-related sustainable development goals, in particular the reduction of premature NCD deaths by 1/3 by 2030. Similar to the WSO, the European Stroke Organization and the lay organization Stroke Alliance for Europe will work on improving stroke awareness and care with the 2018 launch of their Action Plan for Stroke in Europe 2018 to 2030. The bottom line of our call and campaigns is the same for individuals, healthcare systems, governments, and the WHO. Lives can improve with better awareness, access, and action. Furthermore, we suggest that stroke as a disease entity should be more visible in all WHO documents related to NCDs. Rather than the term cardiovascular disease, we favor the use of heart disease and stroke. While stroke has many of the same risk factors as heart disease, it makes a major impact by itself. More importantly, its symptoms, its treatments, and its consequences are unique and sorely under-recognized by the public, and it impacts outcomes. So heart disease and stroke highlights these 2 distinct diseases that together have the overall highest health impact on mortality and disability in the world.